Good morning to Toto and my fellow men. The topic I'm going to discuss today is Chikungunya fever. Chikungunya fever is a viral disease transmitted to humans by infected mosquitoes. A mosquito-borne alphavirus of increasing public health significance has caused large epidemic in Africa and the Indian Ocean basin. Now it's spreading to the Americas. The symptoms and impacts of the disease. Chikungunya fever is categorized by an abrupt onset of fever, frequently accompanied by joint pain. The joint pain is often very debilitating. It usually lasts for a few days, but may be prolonged for weeks, months, or even years. Hence, the virus can cause acute, subacute, or chronic disease. Other common signs and symptoms include muscle pain, joint swelling, headache, nausea, fatigue, and rash. The symptoms in infected individuals are usually mild, and the infection may go unrecognized or may be misdiagnosed. The symptoms can also be similar to other arbovirus in areas where there is co-circulation. Chikungunya fever is often misdiagnosed as dengue. Unlike dengue, however, chikungunya rarely progresses to become life-threatening. People at risk for more severe disease include newborn infected around the time of birth, older adults which higher than 65 years old, and people with medical conditions such as high blood pressure, diabetes, or heart disease. Most patients feel better within a week. However, joint pain can be severe and disabling and may persist for months. Moving on to mode of transmission. Chikungunya virus is transmitted between human via mosquitoes, where a knave mosquito feeds upon a vermic person, and the mosquito can pick up the virus as it ingests the blood. The virus then undergoes a period of replication in the mosquito, before which time it can then be transmitted back to a new knave house when the mosquito next feeds. The virus again begins to replicate in this newly infected person and amplify to higher concentration. When a mosquito feeds on them during the time they have virus circulating in their blood, the mosquito can pick up the virus and the transmission cycles begins again. Within the mosquito, the virus replicates in the mosquito myriad. It then disseminates to secondary tissue, including the salivary gland. Chikungunya virus can be transmitted to a new knave host more quickly than for other mosquito-borne viruses. Laboratory experiments has demonstrated that virus can be detected in the saliva as little as 2 to 3 days after the blood meal. This suggests that the complete transmission from human to mosquito and back to human can occur in well under a week. Once infectious, the mosquito is believed to be capable of transmitting virus for the rest of its life. Next, blood-borne transmission of chikungunya viruses is possible. Cases has been documented among laboratory personnel handling infected blood and a healthcare provider drawing blood from infected patients. Moving on to vector and parasites. The vector are mainly Aedes aegypti and Aedes albopictus. These mosquitoes typically lay eggs near standing water in containers that hold water like buckets, bowls, animal dishes, flower pots, and vessels. Aedes aegypti adults have white scales on the dorsal surface of the thorax that form the shape of violin or lei, while adult Aedes albopictus have a white strip down the middle of the top of the thorax. Each tarsal segment of the hind legs possesses white dorsal band, forming what appears to be strips. Chikungunya fever is caused by chikungunya virus, which is a pathogen of the genus alphavirus and the family Togaviridae. No specific antiviral treatment is available for chikungunya fever. However, a number of therapeutic options are being investigated. Treatment for symptoms can include RAS fluid and use of analgesic and antibiotic. Non-steroidal anti-inflammatory drugs can also be used to help with acute fever and pain. In dengue endemic areas, however, acetaminophen is the preferred first-line treatment for fever and joint pain until the dengue can be ruled out to reduce the risk of hemorrhage. For patients with persistent joint pain, use of non-steroidal anti-inflammatory drugs including topical preparation and the physical therapy, may help lessen the symptoms. Moving on to our final part, which is prevention. No chikungunya vaccine are currently licensed for use in humans, though several are currently in phase 3 clinical trials. In the absence of a vaccine, prevention of chikungunya virus disease depends on community-level mosquito control programs to reduce vector densities and the personal protective measure to decrease exposure to infected mosquito. Personal protective measures include use of insect repellents and wearing long sleeve shirts and long pants. That's all for me. Thank you.